Hello, and welcome to our live web event today for a conversation focused on delivering the humanitarian mission of the American Red Cross during this unprecedented and historic time. Today, we're thrilled to be joined by so many viewers across the country from coast to coast, north to south, as well as our international viewers. We appreciate all of you tuning in today, donors, volunteers, and humanitarians. After all, it is the fundamental principle of the American Red Cross that our concern for all of humanity is what drives us and guides everything we do. So thank you for being here today, and thank you for your humanitarianism. My name is Jill Coyle. I am a proud American Red Cross board member and also serve on the Red Cross National Council of Women Leaders, known as the Tiffany Circle. So here's an overview of our program today. First, we will hear from the incredible President and CEO of the American Red Cross, Gail McGovern. Gail will share with us her thoughts on the state of the Red Cross and delivering its mission these past several months. After she finishes that, she and I will have a discussion based on questions that all of you have submitted. So thank you so much in advance for submitting those. After that, I'm thrilled to be joined by my fellow Red Cross board member and national news journalist, Ashley Banfield, who will be leading a discussion with the award-winning actress and Red Cross humanitarian in her own right, Sharon Stone. Finally, I will be turning it over to my co-chair, Dorothy Alpert, for a discussion with our New York Red Cross interim CEO, Susan Rounds, who will share with us details of delivering the Red Cross mission, specifically in the New York region these past several months. So let's get started. Gail McGovern, in her more than decade-long tenure as President and CEO of the American Red Cross, has led the response to multiple high-profile disasters across the country and around the world, including Superstorm Sandy in 2012, Hurricanes Harvey, Irma, and Maria in 2017, as well as a multitude of tornadoes, hurricanes, floods, wildfires, home fires, and other local disasters that affect our country each year. And then 2020 struck, throwing in a global pandemic and fear of national blood shortages. So with that as the backdrop, no pressure, Gail, a warm welcome to Gail McGovern.
Thank you so much, Jill, for that kind introduction, and thanks for everything that you do to support our mission. I'm just so grateful for your leadership on our regional board and also on the Tiffany Circle. And I want to start by giving everyone a sincere thank you for attending today's virtual event. This is an amazing group, and you represent some of our most generous and committed Red Crossers. And I know a lot of you are based in New York, which was very hard hit by COVID-19. And my heart goes out to all of you and to everyone in this meeting who's been personally touched by the virus. And I'm sure you're all extremely busy and preoccupied during this challenging time. So I'm especially grateful that you joined the meeting today. I should start by saying that despite the back-to-back crises that we've experienced, COVID, unemployment, the tragic murder of George Floyd, I can't imagine anywhere that I would rather be than the American Red Cross. And despite the fact that we've been working around the clock, first adjusting to the new normal of the pandemic, and now with all the protests we've seen across the country, I have to say that my leadership team is continuing to amaze me. They've been persevering to help our country in ways that make me very proud and grateful. And Red Crossers do what it takes to fulfill our mission. And this time of crisis is proving over and over again that that's the case. So many of you in this meeting are dedicated volunteers and donors and leaders, and you're helping to make our work possible. So let me start with our response to the senseless killing of George Floyd and the nation's reaction to this horrendous act and so many similar events. So many of our Red Crossers and the people and the communities that we serve are feeling very real pain fear and anxiety right now. And the Red Cross strongly rejects hate, racism, violence, bigotry of any kind whatsoever. And we stand in solidarity with anyone who's faced the pain and terror caused by racism. I've communicated this message often to our Red Cross employees and volunteers over the last few weeks through several messages and lots of videos. And I've reached out to our African American resource group and to our top 100 Black leaders. And I can't even describe the outpouring of responses that I got from our staff and from our volunteers. They cover the spectrum of grief, sadness, fear. I've heard stories of how mothers instruct their Black teenage sons how to behave when they're being pulled over by the police. I've heard stories about a Black spouse who served in the local police force, which of course is a double challenge being Black and in law enforcement. I've heard stories of racism and discrimination and isolation. And frankly, answering those hundreds and hundreds of notes, it really knocked the stuffing out of me. But most of all, they ended in gratitude and pride to be part of an organization that cares. And the American Red Cross has 7 fundamental principles. In fact, all Red Cross and Red Crescent societies around the globe have to adhere to these principles. And one of those principles is neutrality. But neutrality does not mean silence. 2 of our other principles are unity and humanity. And those principles compel us to speak out against violence and against hatred and against racism. And we need to make sure that this just doesn't become another killing that we mourn and then go back to business as usual. I may be naive, but I'm hoping that this is a moment in our history that can really change behavior. And my leadership team and I are determined to continue the dialogue and to effect change at the Red Cross where it's needed. And from a mission perspective, our folks in humanitarian services have been very involved in the George Floyd passing. There've been several marches and vigils in Minneapolis, and we opened respite centers there. We also supported vigils in North Carolina, where Mr. Floyd was born. We are actively engaged in Houston, where we had 75 volunteers and staff who distributed 2,000 bottles of water and 1,500 snacks in the neighborhood where Mr. Floyd grew up. We operated water stations at the public viewing, which took place in Houston, and that lasted 6 hours. The governor was there, the mayor of Houston was there. We provided snacks, water, and masks for about 2,000 people at a candlelight vigil at the high school that Mr. Floyd attended. And one of our employees who has 35 years of service with the American Red Cross has been very active in the Black faith community, and she was asked to attend the private funeral to represent the American Red Cross. We've also been engaged with our partner organizations in the Black and Brown communities to identify unmet needs and to help respond to them where we can. On a much more uplifting note, somehow in the midst of a pandemic and civil unrest, we've been fulfilling our mission every single day. From a disaster response standpoint, we've had to make significant adjustments to safety protocols to be able to provide services in a COVID-19 environment. And this includes providing comfort and mental health counseling virtually with limited physical contact. We've also developed feeding protocols so that if we open up a shelter, it's not cafeteria style, but separate box meals. We're also using hotels to shelter displaced people instead of large congregate shelters wherever possible. And we've had situations where if we can't shelter this way, we'll take every precaution to make sure our congregate shelters allows for social distancing, for proper sanitizing, and other health and safety protocols. So it's fundamentally just changed the way that we are delivering our mission. And we certainly have been busy with tornadoes and floods and storms. And believe it or not, since February, when COVID reared its ugly head, we have responded to over 17,000 home fires. And for families that were impacted by a home fire and they don't readily have access to the internet, we've been bringing a spare iPhone, and we place the iPhone about 6 feet away, and then we FaceTime with them so that we can make sure they get all the resources that they need to recover, whether it's for PPE or for a place to stay or financial assistance. We've been there. And we also are continuing to see an incredible impact from our home fire campaign. And this is a campaign where we have been installing free smoke alarms in vulnerable households. And we go into the household, we make sure they know how to get out in the event of a fire, and smoke alarms cut the mortality rate in half. And we have already installed over 2 million smoke alarms. Now, of course, we've had to stop these installations because of COVID, but nevertheless, in the month of May, an additional 20 lives were saved because of this campaign, and that brings the total to 760 lives saved. And I'm so proud of that campaign and what we've been able to do. I'm sure all of you know that the hurricane season officially was kicked off on June 1st. And all of the forecasters are telling us that this is going to be a real doozy. And we have been very fortunate so far. We've already had 3 named storms, believe it or not, which is very unusual so early in the season. And fortunately, we dodged a bullet on all 3. Cristobal, which was the one that really looked like it could seriously impact several states, did not, but it was still a really good drill for us. We worked with several state and emergency managers in Cristobal's path, and it gave us an opportunity to review all of our sheltering plans in a COVID environment. We assigned 400 volunteers to Cristobal. 150 of them were going to be virtual. The rest got deployed all around the country in the states where this particular hurricane was supposed to hit. So we had volunteers in Texas, Louisiana, Mississippi, Alabama, and also in Florida. And we had supplies pre-positioned for about 6,400 people that would be in Texas and Louisiana, and it included all sorts of COVID supplies like masks and sanitizers and thermometers, etc. Other parts of our mission, I have to say that when it comes to our blood services, I just can't say enough positive words about the miracle that our biomedical colleagues have been pulling off. Their ingenuity, their speed, their fast reactions to some real significant changes in the demand for blood just over the last few months has been remarkable. They put in all kinds of safety protocols in place, and they're very costly and time consuming, and it adds a lot of complexity to our donor centers. But when the pandemic started, we were facing a big blood shortage. And that's because a lot of elected officials were going out and they were telling people stay home except for groceries and pharmaceuticals. And when we spoke to a number of governors, they said, okay, we'll tell people that blood is essential and you can go out to donate blood. And just when we started getting our inventory back again, the hospitals just all but shut down all surgeries so they could deal with COVID patients. And then we were looking at a blood surplus. And now, as hospitals are starting surgeries again, we're once again scrambling to meet demand. So this has been a roller coaster ride, and somehow we have managed to provide hospitals with the needed blood supply that they need despite all of these rapid changes. And through all of these challenges, we were able to collect enough blood to save lives. And we've done this while we've taken every precaution to keep our donors safe. And we're social distancing at the drives, we're wiping down the beds at the drives, we are taking every single possible measure. We give our donors masks, we give our staff masks, and we're doing everything we can to keep our employees, our volunteers, and our blood donors safe and healthy. And I really couldn't be more proud of the skill that we had to show to be able to make all of these adjustments. And it was really quite an extraordinary time, and it isn't over yet. You probably have heard or read a bit about convalescent plasma. This is when you collect plasma from someone who has recovered from COVID-19 and you transfuse it into a patient who has the disease with the thought that they had antibodies that could then help the existing patient. And in the initial phases of the pandemic, the FDA asked the American Red Cross to serve as the lead in standing this up across all 65 blood bankers in our country. And as you can imagine, this was a massive undertaking, and we moved at the speed of light to put up a website, to get each of the criteria on the phone, setting up appointments, etc. And the agility that we showed in getting this done was really pretty extraordinary. Interestingly, convalescent plasma is still categorized as an investigational new drug, and the results of its efficacy haven't been completely proven, but it looks very positive. We're waiting for a study to come out from the Mayo Clinic to give results on the efficacy of convalescent plasma, but we've already, just the American Red Cross, have sent more than 9,000 units to hospitals, and they have been transfusing these units to patients that are really quite ill. And we've also been stockpiling quite an inventory, over 5,500 units, in case there's a second wave or another outbreak. And this is really important because I am very optimistic that we're going to find out that this is making a difference. And plasma happens to be the only component of the blood that we collect for that you can actually freeze. So it has a long shelf life. So we want to be ready in the event of another outbreak. Another really exciting piece of news that hit the press as well from our biomedical services organization is that on Monday, June 15th, we began doing antibody testing on every single blood donor that walks in and donates blood. And we'll continue to do this for the next 4 months. It's very costly for us. It adds about $3 million of expense a month, but it's going to help give information to our donors, and it's also going to help attract donors. And during this time, we also plan to share the data with the FDA and with the CDC, because it could help from an epidemiology perspective and a tracing perspective. Other parts of our mission, we continue to help our international colleagues around the globe with training, preparedness, financial during the COVID epidemic. As always, we are serving our military members and veterans and their families with emergency connections by phone. We have large calling centers where we do this work, but because of COVID, all of our employees are now taking those calls from home. We also normally provide face-to-face workshops for military members. A good example of that is the Reconnection Workshop, where we help military members that are returning home from deployment reacclimate with their families. So we quickly move the entire workshop to a virtual workshop, and it includes modules like diffusing anger or reconnecting with your kids, and there's a special caregiver module. So we're fulfilling our mission despite COVID. And our training services organization, their course offerings have dropped significantly, which is no surprise because of the face-to-face need for training. But the good news is our training services team quickly stood up 2 virtual courses. One is psychological first aid because so many people are feeling isolated at this point in time, and also social distancing in the workforce. Right now, both of those courses are free for the general public until June 30th. They've been very popular, and we plan on charging $20 for each of those courses. So before I answer your questions and Jill and I chat, I wanted to close by once again sharing a very big thank you to all of you. I'm amazed by your ongoing generosity and your commitment and support of the American Red Cross.
Thank you so much, Gail. Fantastic information, and I know it's been such an incredibly and unbelievably busy few months for you. So thank you, and I particularly liked your statement that neutrality doesn't mean silence. That was very well said. I know in the body of your remarks, you've addressed many of the questions that we received in advance of this session. But there are a few, if you would. So um, one, there's a question that says, where do you see the blood business going over the next 2 to 3
So I really like this question because we have unusual structure in our biomed organization. We're the only country in the world that has more than one blood banker, and in fact, there's 65 of us. So only in America do we have competition like that, and it's great. But there's 65 blood bankers now. The top 3 together the nation's blood supply. So the 3 of us collaborate. We've stood up a venture. That joint venture is all about testing together. So we collaboratively test all of our blood samples, which is great. We work with One Blood to, we're standing up a new IT platform for manufacturing. So I think going forward, there are going to be more areas where we can collaborate and reduce costs and really help our hospitals in a lot of ways, which I think is critically important. I also think there might be mergers and even possible bankruptcies because this has been a tough time financially for the blood banking industry. We did 2 acquisitions in the past. I have to tell you, it's not easy. You've got to share a platform, you've got different payrolls and so on and so forth. But I do think there might be a bit of a shakeout, but I'm really hopeful that they'll find more and more areas to collaborate.
Okay, thank you for that. Sorry, I think we're having slight technical problems, but we're working through it, and we certainly got that answer. Thank you. The next question was, what role will the Red Cross Biomed program continue to play in the fight against COVID?
So you clicked out a little bit, Jill, but let me make sure I'm repeating the question. So how will we help against the fight against COVID? So
yes, as it relates to biomed.
A little bit about so first of all, we've had success with convalescent plasma, and we are going to continue to stockpile that. There are other treatments that are available, but remdesivir, for example, requires a lot of scarce material, and they're not available. So convalescent plasma is probably going to be it. So we're going to be very engaged in that. The other thing is we are really doing everything we possibly can to prevent the spread of COVID by our employees are wearing masks and have PPE. When you come to a blood drive, we wipe down the beds in between every donation. We're keeping people 6 feet apart. We're taking all kinds of extra precautions in our shelters. And we're telling our workers, if you can do your job at home, stay home. So we're working on preventing the spread, and we're also working really hard to have a treatment that could make a big difference in a lot of people's lives.
That's great. I'm sure that'll make our viewers very happy. Here, another question. The past 3 months have seen the Red Cross in our country forced to confront pretty unique crises. Can you reflect on that and the role of the Red
So I think it's pretty safe to say that for all of us in our lifetimes, we have never experienced anything like this. And, you know, it is a bit of a testament to the country's resiliency, because here we are and we're getting through it. I am the eternal optimist. I always have been. I was born with that happy gene, and I'm hoping that when we come from all this, the country is stronger and kinder, and that there's significant changes as a result. I feel like the Red Cross is still fulfilling our mission every single day, despite so many things that have been thrown at us. And I just am really proud of what we've been able to do against all odds. And I think, you know, we've learned a lot of lessons, as have a lot of other corporations, that you don't always have to fly around. You can do meetings like this. There are a lot of lessons learned here as well.
Yeah, absolutely. I think we won't risk the technical gremlins any further, but I don't know if you had any. So thank you so much for your candid discussion today and for your leadership. The Red Cross is unbelievably lucky to have you. I don't know if you had any closing thoughts before we leave you.
Actually, I appreciate the opportunity to close. I know we had additional questions, but you know, time didn't permit to answer every single one of them. So I'm going to give everyone my email address, which is gail.mcgovern, G-A-L .mcgovern at Red Cross, one word, .org. Gail.mcgovern at redcross.org, and I'd be happy to answer any residual questions. And, you know, just in closing, as I said, this is a part of our country's history that's not like anything anyone else has ever experienced, I think, in our lifetime. And I predict the history books are going to be kind to the American Red Cross during this period. And as I said, I think we're going to be a stronger and better organization when this is over. There are times when we all feel exhausted, but to quote Clive Barton, when she was asked how to keep going, she said, think only of the need and how to meet it. And that's exactly what we're doing. And I just feel so fortunate to be able to play a role in our response during this challenging time. And I just want to thank you from the bottom of my heart for your support and your generosity.
Thank you so much, Gail.
Thank you, Jill. You're the best.
Thank you. So now that was fantastic. I hope you all enjoyed that. And now I'm thrilled to be able to introduce my friend and fellow Red Cross board member, national news journalist Ashley Banfield, as she leads a discussion with actress Sharon Stone. Now, Sharon, as you may know, holds an Emmy Award, a Golden Globe, several Academy Award nominations, and 2 SAG Awards. But what you may not know is that Sharon is also the recipient of the Italian Red Cross Gold Medal. So we're thrilled and grateful to have both of them here today, and I'll turn it over to both of them now. Ashley?
Thank you, Jill, and hello, Sharon Stone. How are you?
Well, I am so good, Ashley Banfield. How are you?
You know, it's great. I'm good. I guess all things considered, right? Here we are stuck in our homes and doing the best we can with ring lights and backdrops. And it hasn't been a super easy 3 months, but we're all kind of making it, right?
We in my family are making it with incredible gratitude. We feel so graced to have a roof over our heads and enough food to eat and safety during this kind of precarious time for the world. And we really hope to do our best to help others during this time. It's a crazy time, and my children are 14, 15, and 20, so their entire lives have been nothing but turmoil, although they have some pretty strong opinions about what's happened in their lives.
And this is, I mean, there's not one person who's watching us right now who doesn't know how much of a humanitarian you are, and your causes run the gamut too. And it's just so delightful to know how focused you've been on the Red Cross too. Just, you know, the little shout out that Jill just said about the Gold Medal of Merit that the Italians gave you in 2018. Tell me how that came about.
Well, I started working with the Red Cross when I presented my very first initiative to the United Nations, which was terribly exciting. I presented an idea because my work with AMFAR, with AIDS and HIV over all the years, we started recognizing that we had been able to present enough money so that the scientists developed a drug called nevirapine that stopped mother-to-child transmission of HIV. But I went to third world countries and saw that that really wasn't enough because, of course, the mothers then could not breastfeed their children. And so then I went and tried to put in clean water wells in these different areas to start to understand the issue of clean water in the third world. When I was there, I started to understand how far pregnant mothers were walking, sometimes 5, 10 miles in labor to get anyone who could help them give birth. That it was just so, there was no real understanding of medicine in any nearby areas for so many women in third world environments. And because of the HIV/AIDS crisis, when they were births were in breach or there was difficulty with the labor, even doctors would not reach in to help the women because the gloves were too short and they needed longer gloves to be able to help the women. And so the women and the babies were dying. And when I started to really look at the logic puzzle of this situation, I reached out to the UN about putting on the ground training in so that pedestrians could learn to deliver babies and provide vaccines and give the basic shots and some of the basic healthcare treatments, and how many lives could be saved simply by this basic educational tour of CPR, life-saving skills like we can all get from the fire department in our local areas. Even your children can, and staff, if you have housekeeping staff, can all learn these things. And it's so important to get renewed each year. And so I presented this initiative, and it was presented at the Karolowski Institute and so forth, which is the university that's the study university where the Nobel Institute is. And eventually the Red Cross came on board and started to pick up this initiative and do this. They started to actually provide this care and teach people on the ground how to do these things. So this was 14 maybe years ago, I would say. And so since then, I've taken a variety of different initiatives forward and continued this kind of work. And I respect and admire what the Red Cross does so much. They're out there in the worst situations. And I'm sure, Ashley, you as a news reporter have seen this far more than I have, but I've certainly, when I lived in apartheid war-torn Africa, I mean, Red Cross is everywhere. They are just everywhere.
It is. It was my inspiration for being on the board because of 30 years plus of seeing their work, and not just here in North America, but also in war zones. That was exactly why this was the passion for me. And thank God the Italians saw in you what I know about you. And then I was just delighted to see your social media just a couple months ago, you reaching out to the Italians in their gravest need because of how, you know, distressed they were with the effect of COVID in that country. That was so heartfelt. I mean, that really had to sort of be hard for you to even do, realizing they had just honored you and there they were suffering again.
They have not had suffering like this since World War II, and no one has. And globally, when I saw it happening there, I was sure that we would be having it here. And, we don't really see our brothers and sisters as our brothers and sisters. We have such lines drawn around ourselves that we very rarely stop and just look at the person next to us. And I really see how every baby that we ever see, black, brown, yellow, white, it doesn't matter. But if we see a baby, we're all like, oh, the baby, this is a cute little baby. And we love their feet and we want to chew them and we want to look at them and we want to see them and we want to smell them. And I often ask myself, at which age do we start to hate that little baby? At which age does that line draw around us from each other and from another individual? And I really, in my work, I feel like my main thing that I can do is keep that line from being drawn. Just keep us seeing each other the way we always saw each other from the time we were little.
It's so interesting that you said that. Here we are clearly, again, there's nobody watching this who doesn't know what's going on in the news right now. Huge Supreme Court decision affirming equal rights for LGBTQ people in the workplace. Can't be fired if you're gay. That's a landmark ruling, and it will have implications moving forward for other equal rights. And then there's, of course, these nightly protests on race relations and police activity. And so it's a really, it's a volatile time emotionally, I think, for a lot of Americans. And our company had a big, huge Zoom meeting just to discuss it. And I said, this is a great time to give of yourself and give to charity, because that's something we can all do to equalize each other. If you give blood, right, you don't know what color it's coming from. You don't know what color it's going to. It's just red. But that's sort of, it does seem to be that charity is a great equalizer.
I think that giving is the great equalizer. I think that if you feel bad or sad or upset or concerned or loving, be giving. There is nothing that's going to expand your heart consciousness more than giving and being present. If you can be present with any other person and just sit, you don't have to talk. You don't have to do anything, but just sit and open your heart. This is a complicated time. Sometimes I ask questions that people think are awkward, but they're questions that, as a white woman during this time, I might not know the answer to. Is it appropriate for a white person to do this or that? And the questions are awkward. And sometimes people don't even want to answer them because they feel like I should know. And that's offensive to them. And then to me, I feel like, well, hey, how am I supposed to get to know what's going on if I can't say, I don't know? So I feel right now, the most important thing that we can do is ask and answer. Ask and answer. If you're humble enough to ask, let's be humble enough to answer. And let's all ask and answer.
Dialogue. I mean, it's right. It's all about dialogue. And I keep saying every chance I get, before you hit send, read it out loud. It will probably change entirely by the time you decide to hit send.
I do that. I read my emails. I read my emails out loud, generally speaking, to my assistant of 14 years, who's now more like my best friend and other part of my brain, because I feel like I get a much better sense of if my point is coming across with clarity. And if I'm reaching out in a way that makes sense, and because words can be very confusing, and not English is not everybody's first language either, which is something that we have a tendency to just zoom by.
Right. Hey, so all business, no play. I've got to ask you about your current project, because I'm a huge One Flew Over the Cuckoo's Nest fan. And of course, the key character being Nurse Ratched. There's a show called Ratched and you're in it. Tell me about it.
Well, Sarah Paulson is playing Ratched. And it's going to be from the 40s. Each season is a decade, the 40s, the 50s, and it's going up to when she was in the cuckoo's nest. So we started in the 40s, and I play sort of her counter villain in this season. And it was, I mean, the actors in this, Judy Davis, Cynthia Nixon, Sarah, to work with these women, it's wow. Because, you know, when you're a woman in the film business, you don't get to work with a lot of other women. And there's not an inspired consciousness that we should know and be friends with each other. There's a lot of that dissemination of, you know, only one woman, you know, and 200 men on the set. And so what's been so delightful about working again in this new environment, this sort of post and current Me Too environment, is that there are female crew members, there are other women actors, and especially when you work with Ryan Murphy, it's so exciting. And frankly, I've never had this kind of experience before. So it's just been marvelous. And I worked with Steven Soderbergh on Laundromat, which is still on Netflix, with Meryl Streep. And in all these years, I've never met Meryl Streep. So to have this opportunity to meet and to like and enjoy the company of another fellow actor like that is so rare, because we didn't get partnered in the olden days, in the pre-Me Too days.
In the pre-Me Too days, like 4 years ago.
Right.
Yeah, by the way, she's great. I love her. I met Meryl Streep in at some event years ago, and she came up to me and she said, "Oh, you're so brave." Just like that. And it was like post-war correspondence, and I kept saying, actually, I was really scared out there, but I really love the way you said that.
You are so brave, and my 20-year-old son always had such a crush on you. He loved the news because his dad was a war reporter, and so you were his favorite, just his favorite. He was like, and when you were little and he couldn't even really say your name, Ashley Bamfield, he would say Bamfield. Bamfield. That's my girl I like.
Listen, all this girl power stuff, and here we are in the, you know, the Tiffany event, which celebrates some, you know, top female philanthropist, of which you are clearly one. And so I have something for you, but it's so weird. I normally would present this at the luncheon in person on the dais and all the rest, but see this like really pretty little Tiffany silver bracelet? You see this?
Oh,
this is mine. But guess what this is? This is yours. Yes. And
I'm very proud about
it's going to be arriving in this.
Thank you.
So it's the sort of weird, unceremonious presentation of a Tiffany bracelet, so that you're proudly now a member of the Tiffany Circle.
Well, when I got the gold medal in Rome, all these Red Cross workers came. Hundreds and hundreds and hundreds of Red Cross workers came in their Red Cross uniforms.
Awesome.
I've never seen such a moving sight as all of these people in their goodness, just standing there in their goodness and their courage. Talk about bravery, right?
Yes. Yeah. It's brave to get up at 3 a.m. too and go out and help someone you don't even know in a neighborhood you've never even been because their house just burned down. But listen, I have taken so much of your time, and I can't tell you how great it is to see you, how great it is to talk to you. And I can't thank you enough for your very inspirational message today to all of us. Thank you, Sharon Stone. Appreciate it.
Thank you, Ashley.
All right. Back to you, Jill.
Thank you so much, Ashley and Sharon. Sharon, I loved that description of the Red Cross event in Rome and the Red Cross gold medal. Amazing. That was really a fantastic discussion. Thank you for all that both of you do for the Red Cross here and around the world. So many of our viewers today have already given so generously to the Red Cross, but I would be remiss if I didn't point out that if you have been inspired by our discussion today and wanted to further support the incredible work of the American Red Cross, there is a, not surprisingly, red button at the bottom of your screen, I believe. So you're welcome to, contribute that way, or you can certainly go back to the original registration site, which was redcross.org/Tiffany Circle Series. Again, that's redcross.org/Tiffany Circle Series, and contribute that way. We're hoping to double the impact of any giving today with a challenge match up to $250,000 in donations. So thank you in advance. And now I'd like to turn it over to my co-chair, Dorothy Alpert, who will lead a discussion surrounding the Red Cross mission in New York these past several months. Dorothy?
Thank you, Jill. I'm Dorothy Alpert, and I'm a proud Red Cross board member, and I also co-chair the local Tiffany Circle along with Jill, and also am a member of the Tiffany Circle National Council. I'm inspired every day by what the Red Cross does. Whether it's collecting life-saving blood, like Gail talked about, whether supporting our military members and families, whether it's training thousands of people annually on first aid and CPR, helping families after disasters of all size, from small hurricanes to large tornadoes, working to build our more resilient communities, or supporting missions around the world with our Red Cross and Red Crescent network. It's clear the work of the Red Cross is far-reaching and never stops. I'm certain that each of you have a Red Cross story to tell. The Red Cross mission touches everyone. Down the street, across the country, and around the world. Gail gave us an insight into how things are going nationally with the Red Cross. And Ashley and Sharon touched on an international level. Now, it's time to bring it down locally. In order to do that, I'm honored to introduce to you Susan Rounds. Susan is the Regional Chief Executive of the American Red Cross of Greater New York. She's held leadership and management roles with the American Red Cross in chapters, regions, and national headquarter offices across New York and New England. Susan, thank you so much for joining us today.
Thank you, Dorothy. I am so grateful to you and Jill for all of your work to lead our Tiffany Circle of women leaders in the greater New York region. Jill and Dorothy are just two of nearly 5,000 volunteers that I have the pleasure of working with every day at the Red Cross. Just yesterday, I was at NYU Langone in Manhattan with our volunteers distributing care packages to our healthcare heroes as part of a mission that we have undertaken to support communities during the coronavirus outbreak. The program is called New York City Healthcare Heroes and is sponsored by the Leon and Deborah Black family and Aramark. We are so proud to partner with the Mayor's Fund for the advancement of New York City and with Robin Hood to provide for these healthcare heroes. Just for this project, over 680 volunteers have raised their hands to help. It's just phenomenal. Overall, since March, when New York first went on pause, over 1,000 Red Cross volunteers have stood up to help us with 17 different missions and projects that are supporting the communities during the coronavirus. These projects include bringing food to seniors, delivering masks to vulnerable populations, including veterans, and providing self-care and resiliency training to volunteers, to essential workers, and to veterans across all of our communities. And this all happened while we continue to respond to local disasters, mostly home fires, every day. One person that we met at a home fire recently was Carol Aponte. Carol and her children live in the Bronx. They had just ordered pizza for their dinner on March 27th when a fire broke out in an apartment in their building. During their panic to get out, Carol left her wallet behind, but she remembered two critical things: her medical mask and gloves, certainly a sign of the times. Carol shared with us that she just started running and running. She passed by all of her neighbors, and she just didn't stop. She wanted to keep moving. She took her family to safety with her brother a few blocks away, and then she made her way back to her home to learn what had happened to her apartment. This is where she first met the Red Cross team member who was waiting to help her. Carol would speak with so many Red Cross team members over the next few days as they worked to help her find temporary housing, other assistance virtually, as most of our team is working from home to social distance and stay safe, as well as keep our clients safe. All told, since March 22nd, our team members have helped over 250,000 New Yorkers, providing a little hope during a critical moment in our nation's history. Our concern for humanity is what drives us and guides us. I am grateful to all of you for the support that you give. Thank you so much. Dorothy, I believe there were a few questions.
Yes, Michelle.
Okay. I'm waiting for Dorothy to come back, but I did know that there were some mailing questions. I want to just thank all of you. I can't tell you how touching it was to say thank you to hundreds of healthcare workers who stood online yesterday to receive a package through this program, and to thank them for their service. It was very heartwarming. It was I want to be sure. I'm sorry that we don't get Dorothy back on screen, but I do have a couple of questions that were sent in writing. They're coming over my feed now. Dorothy asked a question about how we're helping the Black community today from the Red Cross perspective. And it's a great opportunity for me to talk about the ways that the Red Cross, in addition to what Gail has talked about, the ways that the Red Cross is interacting with our African American partners, with our volunteers, with those communities. We know those communities suffer from several diseases, including a higher rate of several diseases, including heart disease and diabetes. But the disease that doesn't get talked about enough is sickle cell disease. Sickle cell disease is the most common genetic disease in the United States, affecting about 100,000 people, primarily the Black and African American communities. The Red Cross works to collect blood to help sickle cell patients. A single treatment for a sickle cell patient can be 16 units of blood transfusions in a single transfusion session, and these treatments can't wait. In their lifetime, one sickle cell patient may need many blood transfusions to treat complications of the disease. For people with sickle cell, the Red Cross provides specially tested, typed, and matched blood to help alleviate that patient's pain. Right now, the need for blood is urgent due to an unprecedented number of blood drives that have been canceled during COVID. It's important, if we are in good health, please give blood. It's an easy way to help the community, and it is very safe. The Red Cross adheres to the highest standards of safety and disease transmission prevention, all of its blood drives. So please give blood if you're able. And the second question that was presented across my screen just now is, what else is the Red Cross doing about COVID? And I'd like to talk for a moment about the way we're helping families directly impacted. Our Red Cross family has been impacted by COVID in that we've lost volunteers, we've lost friends, and we've lost colleagues to the disease. The Red Cross launched a family assistance center for the family members and survivors of COVID-19. The virtual family assistance center supports families struggling with loss due to the ongoing pandemic by connecting them with a member of our volunteer staff who are specially trained in mental health, spiritual care, and healthcare professionals who stand ready to volunteer and work with these families. These dedicated volunteers connect with families over the phone to offer condolence, support, and connection to resources. All family assistance center support is provided virtually. It is completely confidential, and it is free. If you or anyone joining us today know someone who could benefit from this program, please contact the Virtual Family Assistance Center either by calling 833-492-0094, or you can visit us at redcross.org/BFAC. Again, redcross.org/BFAC. Is Dorothy joining? Terrific. We don't seem to be resolving our technical difficulties today, and I want to thank Dorothy again for partnering with us today and help Jill and to plan and execute this wonderful event and this conversation and Sharon Stone. So I'm going to turn it back to Jill so that she can close it out and thank everyone for coming. Jill?
Full discussion, and I know we in New York have been going through so much these last 3 months, and the Red Cross has been right there to help deliver all of the humanitarian life-saving mission that that we can to support that effort. So thank you. As we said in the beginning, the Red Cross continues to deliver its humanitarian mission during this unprecedented and historic time. So we're grateful for all of your support. We're grateful today to Gail McGovern, Ashley Banfield, Sharon Stone, Susan Rounds. I hope you've taken away something interesting with this and learned a little more about the mission of the Red Cross. And I hope you'll continue to support us. So have a wonderful day and be well.